Gusto kitang isayaw ng mapagal. Gusto kitang isayaw ng mabagal. Hawak kamay, pikit mata, sumasabay sa musika. Gusto kitang isayaw ng mabagal. Eto na ang kantang hinihintay natin. Eto ng pagkakataon na sabihin sa'yo ang nararamdaman ng puso ko. Matagal ko nang gustong sabihin ito. Gusto kitang isayaw ng mabagal. Gusto kitang isayaw ng mabagal. Hawak kamay, pikit mata, sumasabay sa musika. Gusto kitang isayaw ng mabagal.
Ilalagay ang iyong kamay sa aking bewang.
Isasabay sa tugtog ng kanta ating katawan. At dahan-dahang matitikip ating mga pala. Matagal ko nang gustong mangyari to. Gusto kitang isayaw ng mabagal. Gusto kitang isayaw ng mabagal. Hawak kamay, pikit mata, sumasabay sa musika. Gusto kitang isayaw ng mabagal. Pag natapos na ating kanta at wala na musika,
Kakantahan ka ng akapela sa iyong tenga.
at nanamnamin natin ang pagsasama. Gusto kitang isayaw ng mabagal. Hawak kamay, pikit mata, sumasabay sa musika. Gusto kitang isayaw ng mabagal.
우리 이제 그 얘기는 그만하자. 잠시만 내일이 올 때까지 기다리자. 너가 내게 오늘 들려주려는 그 말은 사실 너 아직 견뎌내지 못할 것만 같아.
just a dream was you. I never thought I would be right for you. I just can't compare you with anything in this world. You're all I need to be with forever. All those years I've learned to hold you in my arms. I've been dreaming of you every night. I've been watching all the stars that fall down, wishing you would be mine. And I just can't believe that you are mine now. You were just a dream that was new. I never thought I would be right for you. I just can't compare you with anything in this world. You're all I need to
Hi, hello everyone. Time check. It's 12:52 in the afternoon. So go invite your classmates na to join our Google Meets because today we will be talking about elderly care. Ayan. Before we start our webinar, we would like to request you to turn off your microphones unless needed. Turn on your cameras at all times. Wear proper and decent attire. And of course, the questions will be entertained during the Q&A portion. We also highly encourage you to post and tag us in the Lasallian League of Nurses official social media accounts that will be flashed in your screens. Okay, as you can see here, that's at official.lln on Instagram, at officiallln on Twitter, and Lasallian League of Nurses on Facebook. Ayan. While waiting for our classmates to enter the Google Meets, magkamustahan muna tayo. Yan, at this point, we are 33. Okay, 33 tayo dito sa Google Meets. Okay, sige. So, I want you to introduce yourself, your section, and what is the most significant or like the most memorable moment with your elderly. What's your favorite moment pala with your elderly, with an elderly? Sige, let's start dito sa mga naka-on cam. Dahil ikaw ang naka-on cam, Ate Mimi, kitang-kita kita dito. Sige, name, section, and what is your favorite moment with an elderly? Kahit sinong elderly, pwedeng grandparents or kaya elderly na nakasalubong mo lang. Kahit sinong elderly, go.
Hello, Kathleen from G3C, and ang favorite kong sa elderly memory ay siguro sa aking grandparents, lalo na kapag tuwing napunta sa kanila, laging busog sa pagkain. Spoiled sa pagkain.
Oo.
Yun.
Ay, year ng kay Ate Mimi. I think we all share the same experience. Like, kapag alam may ginagawa ka and they bring you fruits, gano'n, yung naka-slice na. So, sweet. It's so dearly of them to do that. Siguro ako, personally, favorite moment ko, or like, you know, the moment that I treasure really with an elderly is, of course, with my Lola. She's with me right now. Nasa kabilang room lang siya actually. Kasi we have this favorite restaurant particularly sa SM. And then, we just go there and order a favorite dish. Ayun. Ayun lang naman po for me. Sige, let's see sino pa dito ang pwede nating ma-interview. While waiting, time check, it's 12:55. We still have 5 minutes before we officially start our event. Okay, again, we encourage everyone to invite your classmates to join us in the Google Meets because this is a very significant webinar we have today, and it's very relevant, especially sa third-year students. We are taking up geriatric nursing. So again, we request you to invite your classmates. Okay. Sige, let's see. We have here si Ashley Nicole Papa. Hello.
Yes, hello. Good afternoon.
Ayan, good afternoon. Okay, sige. Very quick interview lang. Please introduce yourself with your name, your section, and your favorite moment with an elderly.
Ayun. So, good afternoon, everyone. I am Ashley Nicole Papa, and I am from the class of G3C. So, I think yung specific, ang tawag ito? Favorite memory pala with an elderly was last time, nung 19th birthday ko, ay nagkaroon ng feeding program din ng LLN. Tapos isa ako sa mga kasama doon. So it's just refreshing na I get to interact with other elderly people bukod sa grandparents ko. And ayun, natutuwa ko kasi na-appreciate nila yung ginawa namin na yun. So ayun lang naman for me. Thank you.
Ayan. Anong year yon? Parang may face-to-face pa nun,
Yes. I think, first year tayo nun. Yeah, first year tayo nun.
Oh, wow, amazing. Ayun. So, thank you so much for your sharing. Maybe we can have another one. Sino ba dito? Okay, dito sa mga hindi naka-on cam. Okay, maybe we can have Krisha Rivera. Hello.
Hello
Hi,
po, good
Kris.
afternoon.
Hi, good afternoon. Please introduce yourself with your name, your section, and your favorite moment with an elderly.
Okay. Hello po, my name is Krisha May Rivera and I'm from G3P, and my favorite moment with my grandparents ay nung tuwing uuwi ako galing dorm every weekend, tapos lagi akong inaalok ng lola ko ng favorite kong food, which is kisa. Ayun.
Ano daw po?
Lagi
Ano po
may
yung
handang
favorite food?
pagkain.
Ano daw po yung favorite food?
Kisa. Rice siya na may banana.
Oh.
Sinaing na rice, tapos may banana. Ayun.
Oh, amazing. Ayan, nakakamiss naman na uuwi ka from dorm, no? Kasi, nakakamiss ang ating face-to-face. Hopefully soon, we get to conduct our face-to-face classes. Ayan. Okay, thank you so much for your sharing, Kring. Let's try to have another one. Ayan, dahil naka-on cam si Alexine May. Hi! Please introduce yourself with your name, your section, and your favorite moment with an elderly.
Hello. So,
Hi.
my name is Alex, or you can call me Ate Alex, 4th year na ako. And yung most memorable experience ko with an elder is, syempre, hindi na tayo lalayo sa mga lolo at lolo na din natin. So, ang pinaka-memorable is yung lagi sila bigla na lang papasok dito kahit kung anong ginagawa. Kahit may klase, mag-aabot lang ng pagkain. Kumbaga, hindi talaga nila tayo hinahayaan na magutom lagi. Yun.
Yeah, I have to agree with that talaga. Especially yung mga lolo and lola na like talagang masarap magluto. Like kahit ano yung favorites mo, gano'n, lulutuin nila. Ikaw ba, are you living with your lola or lolo right now, ate?
Sa Mother's Day.
Amazing. So thank you so much for your sharing. I think Karil May La Rosa is raising her hand. Hello po. Kumusta po kayo? Hi, would you like to introduce yourself? Ayan. Siguro mistaken lang na press yung raise hand feature. But that's okay. That's no problem. Sige, let's try to have another one while waiting. Time check. It's already 1 p.m. guys. I hope you have had your lunch. At sana masarap lagi ang ulam nyo. I think this is our second webinar para sa third year students because we had another webinar kaninang morning. So parang early in the morning siya. Okay, maybe we can have our CI introduce naman or share with us their favorite moment with an elderly. Ito, nakikita ko ang aming clinical instructor sa geriatric nursing, si Sir Ralph Tenorio. Hello po, Sir Ralph. Please introduce yourself po and then share with us your favorite moment with an elderly.
Okay. Di mo na ako mag-open ng camera.
Okay lang po, sir.
Good afternoon. So my name is Ralph Anthony Tenorio. I'm the Level 3 Clinical Instructor for RLE and CM 112 to 114. So my favorite moments with my Lola, kasi Lola lang ang naputan ko. Pag nagbibigay siya ng saging sa akin pang merienda. So yun, nakakamiss yun kasi it's been 15 years since nawala yung lola ko. So, nakakamiss din na may nag-aaruga na matanda sa'yo. So, yun yung experience ko sa mga elder.
Ayan.
Okay.
Thank you so much po, Sir
Thank
Ralph, for
you.
that sharing. Matanong ko lang po, sir, what are you looking forward po sa ating webinar for this afternoon?
So, I'm looking forward na lahat kayo may matutunan about the care for our elderly. And then, hopefully magamit niyo yun as part ng inyong nursing practice. Lalo, pwede natin yung gamitin sa ating mga clinical scenario for this NCM 114. So yun, hopefully lahat may matutunan. At kahit, sabi nga doon dito pag nag-duty sa ibaan, sabi nung isang doktor lagi, so alam niya na mga fourth year na ngayon, so sana mababawasan yung kabobohan ngayong araw na to.
Ayun lang.
Ang tanda ng mga fourth year na nag-duty dito sa amin, sa ibaan. So yun.
Opo. So thank you so much po, Sir Ralph, for that sharing. Sana nga po madaming matutunan ng ating participants for this webinar. Okay.
Welcome.
Maybe we can have another CI. Sino ba ang CI na present at this moment? Okay, wala ko masyadong nakikita. But I am seeing ang aming dating professor sa Nutday, si Miss Conrada Bacong, ate pong dating dean. Hello po! Hello po! Ayan. Please unmute po if you are here. Okay. Mukhang wala pa ata dito si Doc Bacong. Sige, let's have another one instead. Okay, eto. Eto, ang aking classmate na isa pa, si Claudia Marie Picar. Hello, Clam! Please unmute if you are here. Ayan. Nandito ba siya? Okay. Sige, let's have another one na lang. Ito na lang, ang president ng Lasallian League of Nurses. Hello po, Ate Mika. Please introduce yourself, your section, and your favorite moment with an elderly.
Rinig ba ako? Hello.
Yes po.
Ayan. Hi, I am Micaela Joyce Egg from G4A. Siguro ang pinaka-paborito kong memory with my grandparent was pag nauwi kami sa probinsya, lagi kaming may balot or may mga kakanin para kainin, lalo na pag merienda. Siguro yun yung pinakamasaya. Tapos you're in just parang nagpi-picnic ka lang sa farm, parang ganun. Ganun yung itsura, ganun yung vibes.
Okay, sige. Another question daw. What are you looking forward to in this webinar? Ayan daw. Wait lang daw, sabi ni Ate Mika. Sige, ito na lang si Honey na lang ang sumagot. Dale Lara Jean Vargas, hello! Please introduce yourself, your section, and oo. Naput ka ba on spotlight? Sorry na. Tayo lang dito, B. Okay, sige. Go na. Introduce yourself, your section, and your favorite moment with an elderly.
Ayun, I'm Dale Jean Vargas. You can call me Dale. G3C, and yung aking favorite memory ay... Pwede tig-isa?
Go lang.
yung sa aking lolo, ako'y napagbintangang nangunguha ng pera. Ay, hindi naman. Hindi, bata pa ako noon. Yon, ako'y hinabol ng itak. Nadapa ako. Hanggang ngayon, nandini pa yung remembrance. Alalang-alala ko yan ang isa. Yung sa aking lola ay, yung ako'y, puro binantuan ng kumukulong bulang lang.
Oo.
Yun, di naman binantuan na pagkabanggaan kasi kami. Kasi may peklat pa rin ako sa dibdib. Yan, pero wala lang, ang saya. Feeling ko ang saya ng childhood ko. Dahil sama sila.
Memorable. Pa-injury.
Marka, Joyce.
Oo,
Marka.
kitang-kita hanggang ngayon, naaalala mo pa rin yun ang iyong favorite moment. Most memorable. Okay, sige. Dahil busy ngayon si Ate Mika, ipapasa ko sa iyo ang question. What are you looking forward to in this webinar? Ayan, nag-off cam na siya. Ayan, sige. Okay, Ate Mika?
Can you repeat the question, Joyce?
Ayan. What are you looking forward to in this webinar?
What I am looking forward. Siguro matuto pa about how to take care of our elderly. Lalo na sila yung pinaka-vulnerable in times of the pandemic. So, syempre, aside from taking care of ourselves, we should take care of our parents, our grandparents na mas need talaga nila to. Ayun.
Okay, thank you so much for that sharing, Ate Mika. Sige, let's have another CI. Ito si Miss Arlen Adia. Hello po. Good afternoon po, Miss. Okay. Okay, mukhang wala pa dito si Miss. Again, we would like to remind everyone of our house rules before we start our webinar. We would like to request you to turn off your microphones unless needed, turn on your cameras at all times, wear proper and decent attire, and of course, questions will be entertained during the Q&A portion. Again, we highly encourage you to turn on your camera so we can get to see each other. Kahit hindi tayo face-to-face nag-interact, that's okay, as long as we can see each other right now. We also highly encourage you to post and tag us in the Lasallian League of Nurses official social media accounts that will now be flashed on your screens. So that is at official.lln on Instagram, at officiallln, capital LLN on Twitter, and on Facebook, that's Lasallian League of Nurses, for you guys to be updated on the latest webinars or any updates in the College of Nursing. So that would be really helpful. All right, time check. Okay, sige, it's 1:08 in the afternoon. Hello, everyone. Sige, while waiting, let's have another one. Let's interview another person here. Okay. Sige po, wait lang po habang naghahanap ako. Ito, I'm seeing the president of Pre-Med Society. Hello, Renz Tibayan. Are you here?
Hello po.
Hi, please introduce yourself, your section, and share with us your favorite moment with an elderly. Kahit sinong elderly.
Ako po si Renz from G3A, and siguro ang favorite moment ko with my grandparents is every morning kasi kapitbahay kasi namin sila. Tapos every morning, tinutulungan ko sila magluto, tapos we're having breakfast. Then yung kwentuhan namin, parang yun yung pinaka-treasure ko every morning. Ayun na.
Ayan. Thank you so much for that sharing. Ikaw ba, Renz, what are you looking forward to in this webinar?
Ayun, syempre parang gusto ko din maraming matutunan, and also siguro parang mas mag-gain pa ako ng insights para ko sila mas maalagaan and mas ma-appreciate.
Okay. Thank you so much for that sharing. Sana ma-achieve ang ating goal for this webinar. Let's have another one while waiting. Let's have, ayan, ang dati kong classmate nung junior high, si Summer Gail Castro. Hello, Summer! How have you been? Kumusta po?
Hello. Good
Hi.
afternoon.
Good afternoon. Please introduce yourself, your section, and share with us your favorite moment with an elderly.
I'm Summer from G3C. Ang favorite memory ko with an elderly is sa grandparents, syempre, they are so sweet. Lagi nang pag visit kami, hinahaian na ng pagkain, ganyan. And lagi kami kinakamusta. So yun, yun lang nakakamiss sa kanila. Thank you.
All right. Thank you so much for that sharing, Summer. I believe that would be our last interview. Para sa mga nag-wait dyan, ito na, once again, officially. Good afternoon, College of Nursing students, faculty, and staff. I am Joyce Nicola Villana, and I am your host for today. Hello, everyone. How are you all doing? I hope you have had your lunch. It's already 1 p.m. Very late lunch na ako. Ngayon pala nagla-lunch ang others, but that's okay. But of course, you have the energy to listen and learn for this afternoon. I hope everyone's alert, awake, and enthusiastic because madami tayong, we have a lot in store for you guys. We really hope you stay tuned and awake through the duration of this webinar. Syempre, we are all excited para makinig at matuto mula sa ating speaker for today. Of course, the speaker will highlight the ways on how to properly take care of our elderly in the society, especially they're the ones who are greatly affected by this pandemic. Again, we acknowledge our College of Nursing students, especially our faculty and staff, for joining us today. Now, ayan, off with the chika and on with the webinar, everyone. We humbly welcome you to Elderly Care Webinar. So that's the title of our webinar for this afternoon. I know now we have had a webinar early in the morning, but I hope we still have the energy for another one. This would be very vital, especially for us who are taking up geriatric nursing at this point. So let's start the afternoon right with a prayer. May we request Patrice Alea, the LLN Secretary, to lead us with the opening prayer.
Let us all put ourselves in the most holy presence of the Lord in the name of the Father, the Son, the Holy Spirit. Amen. Dear God, thank you for all the blessings you bestowed upon us. May you extend your divine wisdom to our speaker so that she would be able to impart effectively her knowledge to all of us. May she be blessed as she continues to bring her expertise to people who need them. Bless the participants as well so that they would be able to glean the vital information from this activity. May you bestow your blessings after this webinar so that we may go out and spread what we learned. In the spirit of your love and generosity, amen. Let us all pray the Lasallian prayer. I will continue, O my God, to do all my actions for the love of you. Saint John Baptist de La Salle, live Jesus in our hearts forever. In the name of the Father, the Son, the Holy Spirit. Amen.
Thank you so much for that wonderful prayer. May we request the others to join us in the YouTube link that will now be sent in our chat box and will also be sent to our home group chats para hindi tayo masyadong ma-full dito sa Google Meets. Ayan. Okay. All right, without further ado, let us call on one of the lead clinical instructors on NCM 112RLE, Ms. Arlen Dinglasan Adia, RN to deliver the opening remarks. Ms. Arlen, the floor is now yours.
Okay, so thank you. Okay, a blissful afternoon to all of you. It's a moment of great privilege and honor for me to extend a hearty welcome to all of you today. Our generous speaker, Dr. Marie Janice Samuco, our lovely and hardworking Dean, Dr. Margie Evrio, and to our supportive academic chair, Sir Ronnie Amazona, students and participants at this memorable event. Thank you also, Lasallian League of Nurses, headed by Ms. Micaela Macaraeg, for the excellent support in organizing and also hosting our masterclass requirement for Level 3. My co-faculties, especially to Sir Ralph Tenorio, I want you to know how much I appreciate your hard work and dedication to our team. You've done an incredible job and your support has been a huge part of our success. As we all know, this COVID-19 pandemic has had huge effects on these daily lives of most individuals in the first half of 2020. Widespread lockdown and preventive measures have isolated individuals, affected the world economy, and limited access to physical and mental health care. While these measures may be necessary to minimize the spread of the virus, the negative physical, psychological, and social effects are evident. In response, technology has been adapted to try and mitigate these effects, offering individuals digital alternatives to many of the day-to-day activities, which can no longer be completed normally. However, this elderly population, which has been worst affected by both virus and the lockdown measures, has seen the least benefits from these digital solutions. Many elderlies had to face the loneliness every day, and they feel disconnected from society and also dissociated from their families as life progress and burdens become harder to bear. We all know that these older people are important members of any society, and therefore they have the rights to live in dignity in later life. Moreover, these older people possess the skills, yung knowledge, experience, and also continue to contribute effectively to society given the fact that the predicted increase in the number of older people in the coming decades is considered a valuable resource for all society. So, promoting care amongst our elderly, having a preventive healthcare is the aim of webinar on elderly care. So today, we are fortunate to have our speaker, whose expertise and experience are truly remarkable. Her competencies, training, and exposure to the field are rich sources of knowledge and inspiration. So listen and learn from our distinguished speaker. More so, challenge and be responsible future nurses. Thank you very much all.
All right. Thank you, Miss Arlen, for that wonderful opening remarks. That just made me more excited for what's in store for us for today's event. Now, may I request everyone to turn on your cameras for a short photo op. This will be posted in the official social media sites of Lasallian League of Nurses. So, ayan, show us your beautiful faces, everyone, and turn on your cameras. Okay, ayan. Kita ko may nagtu-turn on na ngayon ng cameras nila. Alright. Ayan, sige. Maybe we can have the photo up now? RVG? Okay. Alright. Sige. Let's have the cue. Sino po ang magte-take ng photo? May I ask si Ate Pam?
Potassium channel blocker. It's a new drug. That
Ayan. Alright, sige. Sige, later na lang pang ating photo opportunity. Sige, pero iwanan nyo muna na naka-on ang inyong cameras. Alright, sige. Sige, let's proceed. At this junction, may we call on the Lasallian League of Nurses Programs and Activities Officer, Dale Regine Vargas, to introduce our speaker for today.
Hello everyone, good afternoon. Let me introduce our speaker to y'all. Our speaker for today is a magna cum laude in her course BS Psychology in the University of the Philippines, Quezon City. She also finished her medical degree at the University of the Philippines, Manila. She also finished her geriatrics fellowship at the University of Missouri, Columbia. She is also a diplomat at Philippines College of Geriatric Medicine and also a family physicians. Please welcome our guest speaker for today, Dr. Mary Janice L. Zamuco, MD, FPA-FP, FCGM. Hello po, Dr.
Okay, hello. Thank you, Dale, for the introduction. Good afternoon, everyone. So, as mentioned, I'm Dr. Janice Zamuco, and I specialize in taking care of seniors. So, I'm a geriatrician. And for the next 25 to 30 minutes or so, we'll be talking about some common geriatric syndromes, diseases that we see, and also a bit of the prevention. So, sige, I think you have my slides, no? Okay. Sige, so let's start. Next slide, please. Okay, so I wanted to start with a picture. This is Francisca Susano. She's the oldest living Filipina. Actually, the oldest living person, I think, in the world right now, from Negros Occidental. And she turned 124 years old just this September. Okay, so next slide. All right, so we'll be talking about geriatrics, which basically means the diagnosis, treatment, and prevention of disease in older people and the problems that are specific to aging. So here in the Philippines, geriatrics usually refers to, or geriatric patients are usually those that are 60 years old and above. So geron means old man, and iatreia means the treatment of disease. Okay, next slide. Okay, so you'll hear it often that our world population is really getting older. So sa lahat ng bansa yun, tumatanda, mas marami yung tumatanda. In the Philippines, in the year 2000, we had about 4.6 million seniors. And in 2010, this went up to 7 to 8 million. And it's expected that in the year 2030, about 10% of our population will be made up of seniors. Okay, next. Okay, so what's so different or what's so special about our older patients? Okay, so first, sige, there's a heterogeneity of health status. This means that not all seniors are created equal. Ibig sabihin nun, you can have a 60-year-old that's on many multiple medications, marami siyang sakit. Tapos mas matanda pa yung itsura niya kesa sa 80-year-old na very healthy, still exercising. So I have an 80-year-old who still does yoga and can still do handstands, headstands. So yun, so depende talaga. And then we see the physiological changes. So in all seniors, no, different systems will be affected. Yung kidney function, for example, is not as efficient. The liver can not metabolize as well, or the skin changes. So that's all over. Okay, next. There's also an increased prevalence of disease. So, of course, as we get older, the higher your chances of getting multiple diseases, and then also being on multiple medications because of the diseases. Okay, next. Yeah, and so I mentioned, no, tendency to have multiple diseases. Usually, you have a senior, merong diabetes, may sakit sa puso, may high blood, so halo-halo, sabay-sabay. Okay, next. Seniors also tend to have underreporting of symptoms. So sometimes, I don't know if it's generational, they wait until the last minute. So medyo masama na yung nararamdaman bago sila magpatingin. And that could be because they don't want to burden other people, ayaw nila mang-abala. Yung iba naman, pwedeng financial din, they don't have insurance anymore, so they don't get to see the doctor as often as when they were younger or still working. And then we have a typical presentation of common diseases. So for example, UTI, diba sa mas batang pasyente, mahapdi yung pag-ihi or nilalagnat. In seniors, they can already have a UTI but just have weakness, loss of appetite. So walang fever, walang urinary symptoms specifically. So we have to be aware of any changes. And then there's also an increased importance of social support. So meaning, in pediatrics, di ba sa mga bata, importante yung mga magulang. Sa seniors naman, importante yung adult children. So it's important, they're usually the ones that go with the seniors to their doctor's appointments or talk to their doctors. And then we have an increased rate of adverse effects to medications and therapy. So they're just more sensitive. They're more likely to get side effects compared to a younger patient. Okay. Next, and lastly, we have different goals of therapy. So sometimes for seniors, the goal is no longer cure. Ang importante sa kanila that they'll still be independent, they'll be functionally, they can function on their own and be comfortable and pain-free. So mas yun na, hindi necessarily cure of the disease. Okay, next slide. All right, so we'll start now on geriatric syndromes. So what are geriatric syndromes exactly? So they're basically a predictable characteristic pattern of symptoms or signs that tend to occur in the geriatric population. It's multifactorial. We have health conditions that occur when the accumulated effects of impairments in multiple systems. So hindi lang siya sa puso, sa lungs, kidney. So it's usually multiple systems of the body, which will render a senior person vulnerable to situational challenges. Okay, so next slide. This is a list of the common geriatric syndromes that we usually screen for or look for in our senior patients. So yeah, there's dementia, sleep disorders, osteoporosis, falls and fractures, pressure ulcers, hearing problems, etc. So we'll go through all of these briefly this afternoon, no, just so you have an idea. Okay, sige, next. So we'll start with dementia. Okay, next slide. So dementia is the umbrella term that we use. So it's the general term for a neurologic condition wherein there's a decline in brain function. So there are also physical changes in the brain. For example, lumiliit yung brain in some patients who have dementia. Sometimes there are problems with the circulation. One of the important things when we define dementia is that it affects a patient's everyday functioning or independence. So some patients will be a little bit forgetful, but it doesn't really affect their everyday life. So that's not dementia yet. It is separate from delirium. So iba siya sa taong nagdideliryo, and it's also differentiated from depression or schizophrenia. Okay, next. So dementia is usually reported by family members. Sometimes the patient themselves will tell you, no, medyo nagiging mas makalimutin ako, pero mostly it's the family that notices. It is good to get a patient checked as soon as possible once they notice any symptoms or if you notice any symptoms, because the medications that we have available work the best when you start them early. Also, we know that dementia is a progressive disease. So over the years, patients will usually decline. Mabagal naman, pero yun nga, they worsen over the years. So what we usually do is observe over time. For example, I'll do a memory test now, and then after 6 to 12 months, we'll check again to see if there's any worsening. So dementia is seen in about 5% of those that are greater than 65 years old. But it jumps to 35 to 50%. So may 50-50 chance na once you get to 85 years old. So definitely a higher risk as you get older. But remember that not all seniors will have dementia. So it's common to have minimal problems with memory, maybe slower processing time, harder to multitask, but it usually doesn't get worse. And like I said, no, it doesn't affect the daily functioning of a patient. Okay, next. So what are the domains affected by dementia? What are the symptoms? So usually, kasi iniisip natin memory lang, but dementia is actually, sige, next slide. It affects many domains. So first, we have complex attention. So this is the ability to focus or to concentrate. So for a patient with dementia, it's harder to do many things at the same time. Pag maraming nakikipag-usap sa kanya, nahihirapan siya, nako-confuse. Okay, next. There's also problems with executive ability and thinking. So this is the higher level of thinking, so organized thoughts. For example, a patient that could previously cook, kunyari complicated recipes, nahihirapan na siya ngayon, or dati kaya niya mag-manage ng household, siya nagbabayad ng lahat ng bills, or kaya niya magplano ng vacation, family vacation, ngayon hindi niya na kaya. Okay, next. So learning and memory would still be the most common. So ito yung typical na naririnig natin. No? Symptoms of dementia would be yung lola ko, paulit-ulit, nagtatanong paulit-ulit, same question, kakasagot ko lang, tatanungin na naman. Or it's harder for them to learn new things. Ang naaalala nila mostly yung mga nakaraan, pero kung tinanong mo sila anong kinain nila this morning, hindi na nila matandaan. So that's the most common. And then next, language. So some patients will have problems with word finding, so they can't remember the names of certain objects or names of their friends or sometimes even their family members. Okay, next. Perceptual motor. So sometimes tasks that used to be very easy for patients, they'll start having a hard time. So for example, driving, dati kayang-kaya, so ngayon nako-confuse na sila. Or later on in the later stages of dementia, sometimes patients will even have a hard time eating. So nakakalimutan nila paano gamitin yung fork and spoon. So yan. Sige, next. There are also changes in social cognition. So this deals more with relationships. with other people. So some dementia patients will isolate themselves. So hindi na sila nakikisama sa iba, or they tend to be more irritable, more aggressive. Yung iba, kung dati laging postura, lagi nagbibihes, pag lalabas, ngayon wala na silang pakialam, or they say whatever. They don't seem to care what other people say, think of what they say. So yun. Next. Okay. So now we'll go to the etiology. So what are the causes of dementia? So the most common would still be Alzheimer's dementia. Alzheimer's is the one that we diagnose most often, and we see certain changes in the brain. So yun, yung merong tau protein, neurofibrillary tangles. So that's one type. The next most common would be vascular. Yung vascular dementia is usually from after a stroke. So because the circulation in the brain is affected, the memory is also affected. And then other types of dementia would be Parkinson's disease. So with dementia. So patients with Parkinson's, diba, they have movement, it's a movement disorder. So yung may tremors, naninigas yung katawan. And then a big number of them will also develop dementia later on. Lewy body dementia is similar to Parkinson's, except that the memory problems come first, the cognitive problems come first. Sometimes they will have visual hallucinations, and yun nga, later on they'll have similar symptoms to Parkinson's. Frontotemporal dementia, on the other hand, is more commonly seen in younger patients, so in their 50s. Hindi rin siya common in general, but it presents more with behavioral changes and personality changes. So the others aren't very common anymore. We do try to rule out other causes of problems with dementia, like yan, yung B12 deficiencies or problems with their thyroid. Okay, next. Yeah, so next we'll talk about depression. So what's the difference between depression and dementia? So next slide. Sometimes they present similarly, so it's good to differentiate. No, both patients can present with poor concentration or changes in their sleep habits, as well as decreased interest. So the difference though is in depression, it's usually more abrupt and shorter duration. So usually we say at least 2 weeks, and then yun, we can clinically diagnose depression. Patients can have a previous psychiatric history. They will sometimes highlight their disability. So sasabihin talaga nila na nahirapan ako makaalala, nahirapan ako mag-concentrate. And then when we test them, sometimes they don't even try to answer. Parang sabihin nila, I can't, hindi ko kaya, hindi ko yan, masyado mahirap yung mga tanong mo. They may present with low energy or decreased appetite, as well as suicidal thoughts. Now, comparing to dementia patients, dementia is usually more insidious. So over a longer period of time, diba, usually over years, yan, nagpo-progress. Patients may not have a previous psych history, and sometimes they will even try to hide their disability. So hindi nila aminin na nagiging makalimutin na sila. And when we check their memory, they'll try, but they often miss the correct answers. So sometimes they'll also have changes in appetite, but usually it's in the later stages. Okay, next. All right, so the next syndrome that we'll need to differentiate dementia from is delirium. So, sige, next slide. So, delirium is when, for example, you have patients in the hospital, mataas yung lagnat, so nagdi-deliryo, they're confused. So, as far as the clinical definition of delirium, so we have inattention. Inattention is when a patient has an inability to stay focused. So, kinakausap mo, pero kung saan-saan tumitingin or iba-ibang topic yung pinag-uusapan, or they become withdrawn, they don't really say anything. Next is cognitive impairment. So cognitive impairment, similar symptoms to dementia. So meron ding issues with memory, disorientation, language, but it's not, yung timing is different. So it's usually over a shorter period of time. And then delirious patients can also have behavioral changes. So usually you'll see hallucinations, kung ano-anong nakikita, or they become restless, agitated. Sometimes this can last for weeks or even months after. But usually with delirium, so it'll be over a short period of time and it fluctuates. So sometimes okay sila during the day, in the morning, and then later in the afternoon, they become more confused. The thing with delirium is it's reversible. So usually you can pinpoint what the medical problem is that started the delirium. And then once that's addressed, the delirium improves. Okay, next. Okay, so next slide. Yan. As far as the medical causes of delirium, so this is the mnemonic, no, delirium. So drugs, certain medications like pain medicines or sleep medicines, antihistamines. Some medicines can cause confusion in patients. And then electrolyte disturbances. So when a patient is dehydrated or they have problems with their thyroid, they can be more delirious. Lack of drugs, this means withdrawal. So for example, they're withdrawing from alcohol or sleeping pills or pain medications. Infections can trigger delirium, and then reduced sensory input. For example, they have hearing loss or blurring of vision that can trigger delirium. Intracranial causes, so pwedeng may tumor or stroke. Urinary problems like retention or intestinal problems like constipation can cause delirium. And then lastly, yung myocardial issues, so either a heart attack, arrhythmia, or lung problems like COPD. Okay, next. So just comparing again, delirium and dementia. Delirium, like I said, is more abrupt, acute. It's usually reversible. Disorientation and inattention usually occurs earlier in the course of the disease and it fluctuates. Dementia, on the other hand, is more gradual. It's more long-term, irreversible, and disorientation and inattention usually comes later in the later stages. And it's generally stable. So they might have good days and bad days, but in general, medyo ganun talaga yung kanilang mental status. Okay, next. Okay, so next we'll talk about incontinence. So next slide. Incontinence is the leaking of urine, urinary incontinence. No? So this is again a mnemonic, diapers. So these are the possible causes of incontinence. So D for delirium, I, so any infections, A, atrophic urethritis or vaginitis. So we see this in older patients. P for pharmaceuticals. So again, no, medicines like diuretics, prostate medicines, pain medicines can also add to incontinence. Psychiatric disorders, so depression, excessive urine output. So for example, if a patient has diabetes, there's polyuria, and then restricted mobility as well as stool impaction. So we should encourage our patients to try to discuss this with their doctors. No, it's sometimes they're embarrassed to do it, but there are things that they can do. So it would be good to bring up with their doctor. Okay, next. Okay, so next we'll talk about sleep disorders, insomnia. Okay, next. So the sleep problems, they're very common in seniors. They can either complain about difficulty falling asleep or staying asleep, difficulty with daytime sleepiness. So first we need to determine, as far as treating, we determine first if there's really an impairment. So it's common for senior patients to really have shorter periods of sleep compared to younger patients. So minsan yung iba 6 hours lang talaga. But if there's a real sleep problem, then we always talk about sleep hygiene. So sleep hygiene is basically a group of practical tips that you can give to your patients if they're having insomnia. So first, we recommend that they have a schedule. So parang bata, dapat may schedule sila na same bedtime every night, and then ideally they get up at the same time every morning. So that way their body gets used to it na between this time and this time, I'm in bed. And then if, for example, they're in bed and they can't fall asleep, ideally you want them to get up out of bed and do something that will make them sleepy. So tayo muna sila, magbasa silang libro or watch a slow show on TV. So that way their body knows that when you're in bed, dapat tulog lang talaga. And yeah, you don't want them to use any gadgets at night. So phones, iPads, mga ganun. Kasi the light will wake them up even more. And then other than that, you suggest that they avoid anything with caffeine. They don't want to eat any heavy meals 2 to 3 hours before bedtime. Exercise helps, but you want to do it again earlier in the day. And you want them to get exposed to sunlight, bright light during the day as much as possible. Other than that, we do end up using medications as a last resort. So if, for example, they're already doing the sleep hygiene tips and they still have problems, we try to use it and then temporary only because the medicines do have side effects. Patients can get dependent on them. It increases risks of falling, confusion, affects their memory, and even the issues of the heart. So as much as possible, it's used only as a last resort. And then you also want to check if patients have symptoms of obstructive sleep apnea. So kaya pala nagigising kasi may times na tumitigil sila huminga. So you want to check that because that also affects the heart. Okay, next slide. Okay, so next we'll talk about problems with gait. Okay, next. So with patients who have gait problems, these are some of the common causes. So they might have arthritis, bone and muscle problems, Parkinson's disease, issues with circulation, dizziness, changes after a stroke, problems with their eyes, loss of strength, or even fear of falling. So when a patient has gait problems, it's important that this is picked up early. Ideally, you want to refer them to a rehab specialist so that they can have a physical therapy program because it's important to prevent falls. Okay, next. Okay, so next we'll talk about osteoporosis. So osteoporosis is basically the decrease in the density of a patient's bones. So hindi na kasing siksik, so they're more prone to breaking their bones or getting fractures. So primary osteoporosis can be due to menopause or it can be age-related. Secondary osteoporosis can be from other causes, so endocrine, so if a patient is diabetic, hyperparathyroid, drug intake also, so if they're on steroids, thyroid medicines, chemo or radiation, that can affect their bones. And then malignancy, so for example, they have metastasis to the bones. So again, it's important to try to prevent osteoporosis or to diagnose early and treat because a patient who has it is more likely to get a fracture if they fall. And for example, hip fractures are known to be very debilitating. Some research shows that 1 in 5 hip fracture patients will die within a year after the fracture. So you really want to prevent it as much as possible. And the way to do that is to make sure the patient is getting enough calcium, vitamin D, also weight-bearing exercise. So when they exercise, the blood flow to their bones improve, and that helps with osteoporosis. Okay, next. So falls and fractures, I mentioned, are usually due to gait disturbances. It can also be from sensory problems, dizziness, problems in the brain, dementia, musculoskeletal issues, side effects of medicines, environmental causes, for example, in their house. So marami palang nakakalat sa sahig, loose rugs, may mga cords na pwede silang madapa. So that's why we usually recommend for seniors that, for example, in the bathroom, they should have grab bars or may upuan para dun sila maliligo. So because environmental issues can also increase the risk of falling. And then acute illnesses. So of course, when they're sick, they're not as strong. So the basic point is that we should try to prevent falls in seniors as much as possible. Okay, next. So another geriatric syndrome that we commonly see, next slide, would be pressure ulcers. Sorry, so before we go to that, sige, next slide. Yan, so ito yung pala. Pressure ulcers. So for patients that are bedridden, most especially, no? So usually the pathogenesis for pressure ulcers is, of course, there's pressure, shearing forces, friction, and then increased moisture. There's also additional risk when a patient is poorly nourished, so low protein intake, if they're diabetic, like I mentioned, if they're bedridden, if they're incontinent, and also if they have dementia. Okay, next. So just a quick review of the stages. So we have stage 1 for pressure ulcers, non-blanchable erythema, usually over bony prominences, and it's difficult to detect sometimes, no, in Filipinos kasi kung dark skin. Stage 2, next, is partial thickness involving the epidermis and part of the dermis. So it's usually a shallow open ulcer, and it may present as a blister. Next, stage 3 is full thickness. So this will be bone, tissue, and tendon is not yet visible, but there's full thickness skin loss, and the slough may be present, but not completely covering the ulcer. And then the last stage is stage 4, full thickness tissue loss. So usually we see bone and muscle, and there's a higher risk for osteomyelitis, so bone infections, and often there is undermining or tunneling. And then in the recent years, next stage is the unstageable disease. So if you see this, yung may mga eschar or sloughing, so the ulcer is actually covered, and you can't really see how deep it is. Usually it's stage 3 or 4, but we call this unstageable. And ideally, you don't want to remove it if it's on the heel, but to be able to treat it, normally we recommend debridement. So they have to go to the operating room and a surgeon will remove the covering. Okay, so next slide. As far as pressure ulcers, prevention is always the best treatment. So you want to encourage caregivers or the family members to make sure the patient is turned frequently. So ideally every 2 hours, dapat change in position. And then you want to encourage mobility as much as possible. So that's why bedridden patients are always at the highest risk. Maximize nutrition. So I mentioned, if they have low protein levels, they're at the higher risk. And then, of course, keeping the patients dry. So frequent diaper change, and then using barrier cream in between diaper changes. Okay, next, we'll talk about nutrition. So nutrition in seniors, so malnutrition is very common also. Sige, next slide. For next slide, please. So we will see either more commonly we see patients that are underweight, so they've lost weight, decreased appetite, but some are also overweight. So these can be age-related physical changes. It can be related to chronic illnesses. Some or most seniors will have a higher percentage of body fat, and so that's one of the physical changes that we see. As far as side effects of medications, for example, patients that are insulin on steroids will gain weight. There's also the lack of exercise. Patients who have dementia or depression will not eat normally. They can have dental pain or issues with swallowing. Sometimes there's excessive alcohol or drug use, and occasionally it's also financial. So it's important to address malnutrition early as well, because it will increase the chances of a senior getting weaker and more frail. And like I said, they're more prone to other diseases. Okay, next. All right, so next is constipation, which is another common issue with seniors. So next slide. As far as constipation, it's defined as 2 or more of the following in more than 25% of defecation. So if a patient has straining, lumpy or hard stools, sensation of incomplete evacuation, sensation of anorectal obstruction or blockage, has to use manual maneuvers to be able to have a bowel movement and has less than 3 defecations, 3 stools a week, then that would be defined as constipation. So we want to encourage our seniors, first of all, to increase fluid. So very commonly, they don't drink a lot of water. So ideally up to 6 to 8 glasses, as long as they don't have any issues with their heart. You want to encourage more fiber. So more fruits, vegetables, less pork or beef. And you also want to encourage exercise again. Okay, next. All right, next is vision problems. Sige, next slide. So vision problems, of course, no, very common in seniors. Next slide, please. So 30% of visual problems occur in those that are above 65 years old. And it tends to develop slowly, so sometimes they don't notice the changes. And the common things that we see would be cataracts, age-related macular degeneration, glaucoma, and diabetic retinopathy. Cataracts these are actually the most or the 5th most common chronic condition in adults that are over the age of 65. So it's important to address vision problems again in relation to safety, no, preventing falls. Sige, next. Yun. So as far as safety, aside from falling, if they have issues with their eyes, it'll be harder for them to take their medication safely, harder to navigate around the house if they have stairs, difficulty driving, so they'll tend to lose their independence, difficulty crossing streets, and this will affect their quality of life as well. So like I said, no, they become more dependent on other people, and then they can also have issues with they can't use the computer anymore or read on their own. Yun. Sige, next. Okay, so next we'll talk about hearing problems. Sige, next slide. So hearing issues would be the third leading cause of chronic conditions in seniors. Presbycusis is the gradual loss of hearing. It's usually progressive and bilateral. We commonly see that the loss of high-pitched sounds will come first in seniors. So pag may kausap tayong matanda, hindi kailangan sumigaw, nakakatulong pag mas mababa yung boses. So if you use a lower voice, it'll be easier for them to hear you. Yan. Sige, next slide. So as far as the implications of hearing changes, so again, similar to vision, it can impact the quality of life. It affects the ability to communicate with others. And again, it affects safety. No? So patients will have problems hearing instructions. They might not hear a car if they're crossing the street. They won't hear the phone or doorbell if someone's knocking. So this can add to social isolation as well as depression, so similar to visual changes as well. Sige, next. Okay, so the next slide. The next syndrome that we'll be talking about, I think we're almost done, is polypharmacy. Sige, next slide. So polypharmacy is defined as taking an average of more than 4 medications. So that's the average actually that seniors will take in a nursing home patient or someone that's more frail. This can go up to 8 medications. So this can be also partly the doctor's faults, no? Kasi they will see, a senior patient will see many different doctors, and 60% of the time, a doctor's visit will end up with a prescription. Sometimes seniors are also reluctant to stop their medicine. So kahit na medyo stable naman na yung sakit, natatakot silang itigil. There are medications that have no apparent use. So sometimes they don't even know what they're taking the medicines for. There can be duplicates. So parehong generic name pala, magkaibang brand lang, they're taking both. Sometimes they can have medicines that are interacting or contraindicated, inappropriately dosed. For example, kidney patient, so dapat mas mababang dose pala pero hindi na adjust. And then sometimes there are medicines that are just taken to address the side effects from other medicines. Okay, next slide. So this is helpful resource. Dr. Mark Beers is a geriatrician and he's a co-editor of the Merck Manual of Geriatrics. And if you Google the Beers criteria, so he came up with this in 1991. The Beers criteria was originally a listing of inappropriately used drugs in the nursing homes. And then in 2003, this was expanded to all care settings for geriatric.
All right. I think we're having slight technical difficulties. Okay, let's just wait for Doc to come back. Okay. Sige, time check. It's already 1:56 in the afternoon. Again, our questions will be entertained later on. We have three ways on how you will be doing our question and answer. First is a Menti chat box and raise of hand. You may now start preparing your questions, which will be entertained later on. I think Doc is here. Okay. Doc,
Ayan,
the floor
sorry.
is now yours. It's
Sorry,
okay.
nawala. Okay. So, were you able to hear me until the last part of this slide, yung 2003 it was extended?
Yes, miss. I think that's okay.
Okay, sige. So let's go to the next slide. I'll give you this is just a sample of the information that you can get from the Beers criteria. Sige, next slide please. Ayun, hindi pala masyado kita. So anyway, I don't think this came out very clearly. But so anyway, it lists medications. For example, yung nitrofurantoin is a medication that we commonly used in the past to prevent yung recurrent na UTI. So we would give it often, but in the Beers criteria, it's actually included as one of the medicines that we should try to avoid in seniors because it can affect lung health in the long term. So, ayun, nawala ang ating slides. Ayan. Ayan, so yan. So that's one example, the nitrofurantoin. And then another is amiodarone. So it's also in the list. It's a common medication that we use for atrial fibrillation. But again, no, in the Beers criteria, it's actually recommended that we should avoid it as a first-line medication because it's more toxic compared to the other antiarrhythmics. Okay, next slide. Yan. So this is just a quote from Dr. Beers. Now, we never said that you should never use these drugs in the elderly. We just said that clinicians should think very, very carefully about whether the drugs mentioned in the criteria are the best choice for their elderly patient. There are instances where they may be appropriate, but most of the time these drugs are being used inappropriately. So yun, again, I just encourage you to look it up on your own. It's online. You can see the whole list. So it's a good guide. Hindi naman siya black and white, but it helps to know what medicines are riskier for senior patients. Okay, next. All right, I think ito last na to, yung frailty. Sige, next screen. Yun, so frailty is a syndrome that we look for if you think of your oldest old patients, no, in their 90s, 100s, yung mga mahihina na yan sila yung mga frail patients. The criteria is some weight loss, exhaustion, so they're always tired, low physical activity, so sedentary lifestyle, strength, so nanghihina, and then slowness, so they walk very slowly, they move very slowly. If you have 1 to 2 of these factors, then you are diagnosed as pre-frail, intermediate, and then more than 3 would categorize you as frail. Okay. Sige, next slide. Yan. So I think that was the last. So with frailty, you just want to make sure, again, no, similar to gait problems, you just want to pick it up early and address it as soon as possible. So that's usually it's multidisciplinary. So you have rehab on board, so help with physical therapy. There's a nutritionist on board. Sige, next slide. So this is just, again, a review of all the syndromes that we went through. So, sige, next slide. So as far as the syndromes, usually, again, it's a multidisciplinary team. So that's why it's good for you as nurses also to be aware of them, no? Because as we are exposed to senior patients, doctors from different specialties, nurses, nutritionists, physical therapists, occupational therapists will work together to identify and also to treat and address the syndromes that we see in seniors. We have what we call a comprehensive geriatric assessment. So that's usually about an hour, 1 hour and a half that I spend with a senior patient to go through the syndromes and assess them. So yun, merong test for dementia, may memory test, we watch them walk, we check their nutritional assessment, screen for depression, etc. So it's one of the assessments that we do mainly as geriatricians. Okay, I think that's it. Next slide, meron pa ba? Okay, that's it. So thank you for listening.
All right. Thank you so much, Dr. Zamuco, for giving us valuable tips on how to take care of our elders, especially our grandparents. This will serve as a reminder for us to give back to our grandparents, just as how they took care of us when we were little. So just to recap, Dr. Zamuco has shared with us various diagnosis, treatment, and prevention of diseases in our Lolas, as well as specific problems to aging. Like what Dr. Zamuco has said earlier, prevention is the best treatment. So as sons, daughters, grandsons, and granddaughters of our elderly, let's all make an initiative to prevent worsening and, of course, the hardships felt by our elderly through taking care of them and providing them with genuine love and support. And, of course, by applying the learnings we have had this afternoon. Ayan. So truly, Dr. Zamuco's talk hits close to the heart and home, and there may be some questions running around your mind right now. And with that, I am opening the floor for our Q&A portion. All right, as mentioned earlier, for your question and answer portion, we will be utilizing 3 methods. That would be Menti, chat box, and raise of hand. If you want to ask anonymously, I think the guidelines are here. Allow me to read them. If you want to ask anonymously, the Menti code will be flashed in the screens and it will also be sent in our chat box here. Once you're on the website, just enter the code and type in your question. So the link would be just menti.com and just press enter. Feel free to type in your questions in our chat box as well. Please indicate your name and section. So basically just name, section, and proceed with your question. And another mode of asking will be by clicking on the raise hand feature. I think it's just here on the tab at the bottom of our Google Meets. And you may now start inputting your questions. I think we can proceed with the Menti code. Can it be flashed on our screen right now? Again, you just type in menti.com on your search tab and then enter the code that is now flashed on the screen, and you may now start asking your questions. Again, we have 3 methods. That's by Menti, chat box, and raise of hand. Please wait to be acknowledged before speaking if you want to ask your question live. All right, let's just wait for the questions. All right, I think we have one here. The first question is, what is the best way to handle situations where elderlies have a hard time listening to quote-unquote young healthcare workers?
Yeah. Very common yun. No? Actually, yung madalas nakikita ko pag parents, if it's your own parents or yung grandparents, because they, especially if it's you, no, kasi they're familiar with you and they don't really see you as an authority. So, mahirap talaga yun. Normally, what you can do is just give them your opinion, give them your thoughts in a very objective way na pwede rin kayo magbigay ng references. I mean, if they're that type, no, na mas maniniwala sila pag merong kang finorward na article or something like that, that can help. Otherwise, you might just have to refer them to one of your colleagues maybe. Minsan kahit mas hindi naman kailangan na talagang senior na matanda, pero sometimes it's just different if they hear it from someone else and not from a family member.
Okay, thank you so much. I hope that answered your question. That's from an anonymous person. And we have another question here. It says, how can I help my grandparents who are living from afar?
So I don't know if this is because of the pandemic, kaya living afar or ano, pero I mean, if you can't physically be there with them, so normally, kunyari yun, no, like with this pandemic na, kasi isolated yung senior, so normally we encourage them to really schedule family, either Zoom or Viber or whatever meetings, so that the seniors will not get lonely or more prone, kasi medyo common talaga ngayon, ano, mas maraming nagkaka-depression, anxiety, kasi hindi nga sila makalabas, hindi nila kayo makita, hindi makita yung mga apo. So that helps, no, just scheduling meetings. Yung iba pag malaking pamilya, sinasabi namin mag-assign kayo, kunyari one family member, kahit every other day dapat merong kausap yung lolo or lola. Other than that, pwede rin exercise, so you can find yung mga videos online that you can use to exercise together with your senior family members. So para at least medyo mas ganahan sila kahit papaano may kasama. Those are the main things siguro, aside from depende rin kasi how frail your senior grandparents or parents are, no. It helps to have someone always checking in on, kunyari, yung vital signs nila, kung merong nag-check or merong nagre-review ng gamot nila. Some will prepare the medicines. Kunyari, you don't live with them, but at least set out their medicines for the week. So things like that.
Okay, I think we have, as of now, we have 11 questions. Again, our Menti code is 182988136. So if you have any questions, just type in menti.com and enter the code so we can answer your question. We have another one here. It says, what advice could you give to those family when the elderly situation become worsen, or best advice to cope with the situation?
So medyo general. If a situation gets worse, what advice can I give her? Yeah, so siguro ano lang din, you want to reach out for help if you're having issues with your senior family member, already tried dealing with things on your own. So yun, I think best to go and talk to either a geriatrician or to the regular doctor, just to get yun, recommendations, kasi yun nga, parang mahirap naman kung kasi ganun, ano, we feel responsible. Syempre, you're in the health field, but sometimes you really need to ask for help.
Okay, thank you so much for that po, Doc. We have another one here. It says, what do you find the most interesting part of working with the elderly? I think this is a personal question po.
Yeah, it's a good question. Ako personally, I like just talking to the seniors kasi marami sila palaging kwento. Typical lolo't lola, di ba? Maraming kwento. Tapos minsan natutuwa kasi sila kahit na ano lang, parang even if you don't necessarily address all their problems, but just having someone to listen to them helps, no? Yung iba ganun sasabihin nila after nila magkwento, parang, ay, mas maganda na yung pakiramdam ko, Doc. Parang para lang may makausap may makausap sila at may makinig sa kanila. So I like that part of it, just talking to the patients themselves.
All right. Thank you so much for that po, Doc. We have another one here. It says, how can I handle the aggressive or violent behavior of an elder?
Okay, so yun, that's also a good question. No? With usually, so first you want to find out why the patient is aggressive or violent. Kasi yun nga, yung iba, nag-iba yung behavior dahil may nararamdaman pala, they have they have an infection, or if it's already part of their, for example, someone who has dementia, ganun talaga, no? Sometimes there are outbursts of aggression or violence. We always say use behavioral methods first. So last resort yung gamot. May mga gamot na pwedeng bigay, no, antipsychotics that will calm patients down, but again, there are side effects. So the first would be behavioral methods. So parang bata, you try to distract them. When they're aggressive, you either play some music, give them something to touch, to hold, turn on the TV, bring them out. Yung iba nagda-drive, pinapasyal lang, lalabas, naglalakad. You want to try to divert their attention. And then ideally, especially with patients with dementia, you don't really want to contradict them anymore. So kunyari meron silang pinagpipilitan paulit-ulit, wag nyo nang i-correct kasi ganun din parang ano rin, after a while they'll forget and then they'll go back to what they were thinking in the beginning. So kumbaga sasakyan na lang. You just give them what they want as much as they can. Kung kunyari yung iba, yun, hanap sila ng hanap, hinahanap nila yung namatay na nilang kamag-anak, or gusto nilang, yung iba, very common, yung nag-iimpake, gusto nilang umalis, bumalik sa bahay nila, pero doon naman sila nakatira. So you find creative ways to just let them do it if they want. If they want to pack, let them do it, tapos iikot-ikot nyo lang sa kotse, mga ganon. So you have to try to find a way to, to not to make the situation worse, parang not to trigger them more. So as much as possible, pagbigyan.
All right. I think that's a very valuable tip or technique from Doctora. So again, we have another one. Who is the appropriate person to decide when situation worsens? Is it the patient or the family? I.e., with respect to the rights of the patient.
Yeah, so technically it's always the patient, no? The patient always decides for themselves. So unless they're not able to anymore. So for example, if you have a patient with end stages now of dementia, they can't really understand the situation, then the family will have to decide for that patient. We always encourage what we call advanced directives. I'm not sure if you're familiar with that. Yung advanced directives, bale in advance, ako usually, I try to ask my senior patients already, what do they want done in case of an emergency? Kunyari, biglang magka-heart attack sila or magka-stroke. Willing pa ba silang pumunta sa hospital? Willing ba sila na magpa-CPR or magpa-intubate? So you ask them in advance. If they cannot eat, willing ba sila magpalagay ng NG tube or magpalagay ng PEG? So ideally ganon. So parang habang maaga, napag-usapan na. It's not always an easy conversation, but it helps, no? So that the family members already know what the patient wants. So even if he gets to the point that he cannot say it himself, at least you have an idea what the patient wanted from the beginning. And then we also ask, who do you want to assign as your power of attorney? Meaning, which family member do you want to decide for you in case you cannot decide? So yun yung ideal talaga. You ask them early. But if you can't, yun nga, when the time comes, then you also try to decide if the patient can't decide for themselves. You try to decide based on what you know about the patient. Ano ba yung personality ng lolo at lola nyo? Ano ba yung sa tingin yung gusto nila kung nakakapag-desisyon pa sila para sa sarili nila?
Okay, I think that's a very relevant advice, especially to us who will be future healthcare workers. Okay, we have here another question. How to take care properly of bedridden grandparents?
Okay, so when someone's bedridden, yon I mentioned earlier, no, important talaga that you try to prevent pressure ulcers. So make sure they're turned every 2 hours. Kung kayang umupo, pa iba-iba yung position, you can have them sit in a chair. Yung iba may belt para lang hindi mahulog. So kahit 3 times a day. Yun, you want to make sure they're dry as much as possible. Frequent diaper changes. And then yung exercises are also important, no? So kahit passive range of motion lang, if they cannot actively follow instructions anymore, no, at least you do the stretching ng limbs. So that helps to keep the muscles a little healthier kahit papaano. And then nutrition is also important. So yun yung mahirap kasi nga pag bedridden. So you want them to stay nourished as well.
Okay, I hope that helped. So we have another question. It says here, does diverting the attention of sick elderly to new hobbies help them cope up with their daily lives?
Yes, no, okay yun. New hobbies, learning new things, that's good. It usually, ano pa rin, no, normally you still, of course, want to cater to their interests kasi hindi mo naman sila pwede pili. But if they find something that they like to learn, then that's good. It's good for their mood, and it also helps with their memory and trying to prevent dementia. Kasi ang nangyayari when we learn new things, we form new connections in our brain. So it's helpful to encourage them. So yung iba, yung iba, di ba, nagka-crafts or there are games online, di ba, yung dati yung Luminosity. Meron din yung Brain HQ. It's often recommended by neurologists. Brain HQ is parang program siya specifically to help with dementia patients. So merong subscription, meron ding a few free exercises. So that's a good one to try.
Okay po. Thank you so much po for that answer. I think the next two questions are personal questions. Sige po, let's begin. It says here, what inspired you to take on and study specifically geriatric medicine?
Yun nga, specifically siguro, yun, parang ever since I've enjoyed talking to seniors, parang natuwa lang akong kausap sila. When I did a residency in family medicine, and I think when I was applying, nagkataon, I was staying abroad kasi yun, so I was staying with different family friends, tas puro seniors yung natiran ko, nagkataon. So na-realize ko lang din talaga that I really liked dealing with that population. So, and then of course, parang after family medicine, naisip ko rin yung parents ko. So I wanted to do something that would really help me also to take care of my own parents. So.
Okay, so I hope that answered your question kung sino man po ang nag-ask ng question na ito. Okay, another, I think, personal question. What is the reason behind your success daw po?
The reason behind my success? I don't know, how do you define success pa? Parang sa akin, I mean, as long as I consider myself successful when I know that I've done my best. So, kasi ako, I'm a Christian, I'm a professing Christian. So, yun yung goal ko talaga in whatever I do. I try to do it for God's glory. So, even if I'm not, let's say I don't publish papers or I'm not the most well-known geriatrician in the Philippines, parang sa akin, successful na basta you do your best.
Okay, thank you so much po for that answer. Okay, going back to our main topic, I think this question is related to the question asked earlier. It says here, how can I handle an elderly with anger issues? I provided facts, but they deny the facts that I gave them and they love their pride more. I think this will be slightly related. And it could be related with, for example, being afraid of the vaccination and such, ganun po.
Yeah. So you can only do so much. I always tell adult children this also, no? Kasi naiinis din yung mga seniors pagka yung feeling nga nila, sila naman yung magulang, bakit ba sila pinipilit? So I think our role will be more of, yun nga, you present them the facts, you give them, you inform them, but in the end, we really have to respect their decision and let them decide on their own. Kasi they're like any other patient, di ba ganun din naman tayo. We give our patients the options, we give them our advice, our recommendations, but in the end, you have to let go and let them decide.
Okay, thank you so much po for that advice, Doc. We have another one here. I think this would be our last two questions. So the first one, it says here, how to approach po your grandparents on their sleep schedule. They tend po kasi to get angry when I try to tell them to reduce the use of TV or gadgets before sleeping. I think this is a common problem to elderly people. Opo.
Yeah. Wala ganun din. Parang basta you tell them what the recommendations are, and then siguro you can also Because it will also depend on how much the insomnia is affecting them. So maybe you can remind them no na if you really want your sleep schedule to improve, kung gusto nyo na mas may energy kayo during the day, hindi yung lagi na lang silang nakakatulog when they sit down during the day. If they want to be able to do more during the day, then this is what they need to do. Kasi yung iba naman parang sila na they complain about it but they're also just comfortable already. They're used to it na ganun sila, natutulog sila madaling araw, tas nagigising sila mga 11 na or pa-idlip-idlip talaga during the day. Yung iba, they don't mind. So kaya rin siguro they're not as motivated to really change things. But yeah, so maybe you can remind them about what the advantages are. If they another thing is if you tell them na yun nga, aside from being able to do more during the day, definitely yung a good sleep habits and having enough hours of sleep will help keep them healthy. Yung immune system nila becomes affected whenever they're sleep deprived. So everything is they're more prone to getting sick. So yun, paalala nilang lalo ngayon with the pandemic.
All right, I have to agree with what Doctora said. Pero, and syempre, just to add po, I think it would be better if we become more calm in telling them na this should be done, na these are the advices I'm doing. And let's try not to be aggressive. Kasi syempre, elderly na, pag mas naging aggressive tayo, baka mamaya lalo tumigas ang ulo or whatsoever. So, I think it's a matter of the way of advising din po. So, ayun lang naman po for me. I think this would be our last question, Doctora. It says here, what kind of meditations po can you give for the seniors so that they can reduce their stress or overthinking?
As far as addressing stress, anxiety, and normally yung parang basic we encourage them to exercise, so that helps no. If they're spiritual, you advise them to syempre to pray, to read the Bible, or to read verses, but anything that will help calm them down. Yung mga practical, so listening to calming music. Yung mga psychologists, sometimes they also say, for example, you're in the middle of a panic attack. May mga pasyente kasing ganun, di ba? Yung talagang sobrang stress, they start palpitating, they can't breathe, ganyan. So yung typical, yung deep breathing exercises, they say when you take deep breaths, you look at your stomach, yung abdomen dapat. So dapat yung deep breaths, that when you inhale, your stomach goes in, your stomach goes out when you exhale. So hindi lang chest. So yan, yung deep breathing exercises. And then recently lang kasi may narinig akong lecture about that, yung what they call grounding. So grounding meaning if you're very stressed, you're anxious, and you can't think, you ask them to use their senses. So look around, think of 5 things that you can see, and then I don't know if you've heard this before. 5 things that you can see, 4 things that you can hear, 3 things that you can smell, touch pala. 3 things that you can touch, 2 things that you can smell, and then 1 thing that you can taste. So parang you're just distracting them also, making them think of what's around them so that they focus less on their anxiety. So yun.
Okay po. Thank you so much po for that, Doc. Let me check po. Do you guys have any follow-up questions? Allow me to check the chat box. Okay, I'm seeing none over here. The discussion must have been really clear po. Ano po? So thank you so much for that. That concludes this webinar's Q&A. Thank you so much to those who asked. And of course, thank you so much to our speaker for sharing her knowledge and stories, and of course for answering our questions for today. This would really help all of us, especially we are all in the medical field and future health workers. We really learned a lot from you po. So thank you so much for inspiring us. This event wouldn't be possible without our participants and guest speaker for today who spared time in attending this event. All right, to show our gratitude to our speaker, may we call on the LLN third year class representative from G3B, Krija Rivera, to present the certificate of appreciation. Let's just wait for it to be flashed on screen before. Ayan po. Okay. Krisha, the floor is now yours.
Okay, let me read the citation po. From the College of Nursing, the Lasallian League of Nurses awards this certificate of appreciation to Dr. Mary Janice Legaspi Zamuco for sharing her time and expertise as a resource speaker during the webinar entitled Elderly Care, held via Google Meet on this 20th of October 2021. Signed by the President of Lasallian League of Nurses, Micaela Joyce B. Macaraeg, the advisor of Lasallian League of Nurses, Ms. Rayan Rose D. Magkawas, RN, MAN, LMT, ITech Deep, Sir Ronnie M. Amazona, RN MAN, the Program and Clinical Area Chair, and Dean Margie M. Ebreo, RN MAN, PhD.
All right. Thank you so much for that, Krisha. Again, may we request your brightest smiles for our best memories to be documented here in this webinar. We will have a very short photo opportunity with our dear guest speaker for today. So please turn on your cameras and let's have our photo up. Okay. Okay po. Let's have it now. Are we ready, everyone? Okay, sige po. Let's start na po. Just hold your smiles. 1, 2, 3. Okay. Let's have another one. 1, 2, 3. Okay, last na po. 1, 2, 3. All right. Okay. Thank you everyone for participating and sharing this moment with us. Okay, to cap off this webinar, may we call on the lead clinical instructor of NCM 113 and NCM 114 RLE, Miss Christina Medina RN Man, for the closing remarks.
Good day to everyone. It is my great pleasure and honor to give the closing remarks. Today, we are in a very difficult time as we are facing the COVID-19 pandemic. Yet, it was not a hindrance to make the masterclass in geriatric nursing possible. Through your presence and participation in this webinar, we have attained our objectives, and I hope everyone will apply the knowledge we have gained today as we work together for the betterment of our service through this valuable profession. On behalf of the La Salle Lipa College of Nursing, I would like to thank Dr. Mary Janice Samuco, our speaker, Dr. Margie Ebrio, our dean, Sir Ronnie Amazona, our academic chair, co-faculties, Lasallian League of Nurses, headed by Ms. Macaraeg, ESN students, especially sa ating third-year students, for being part of this masterclass. Do accept my warmest congratulations for the excellent results. To our students, our future Lasallian nurses, keep learning and growing. May you always carry these learnings with you, with a heart ready to serve. Stay safe and God bless everyone. Animo Lasal.
Thank you so much for the wonderful words, Miss Medina. Let's now have our closing prayer to be led by the LLN fourth year class representative from G4B, Miguel Quimpo.
Okay. Let's put ourselves in the presence of God. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Thank you, Lord, for a successful webinar. We know that you bless us, hence this success. May you keep blessing as we go out of this meeting and apply we have learned in our own profession. Grant that we do this fully aware that it is not for ourselves that we learn, but for the service of other people. Make us realize that all our actions and plans should be done for your greater glory. Shower us your divine guidance so that we would decide wisely and properly. Make us realize that without you, we are nothing. All this we pray and offer to you. Amen. Let us all pray the Lasallian prayer. I will continue, O my God, to do all my actions for the love of you. Saint John Baptist de La Salle,
Pray for
pray
us
for us. Leave Jesus in our hearts
forever.
forever. In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
And that concludes our webinar for this afternoon. Announcement for our participants: the evaluation link will be flashed on your screens, and we'd like to know your comments and opinions, so we highly encourage you to answer it. Your certificates will be sent after evaluating this activity. I believe it is also sent in our chat box right now, so you can now evaluate. Let us now sing with pride and honor our alma mater.
A shield of green and white, we'll fight to keep your glory bright, and never shall we fail. Hail to thee, our alma mater, hail, hail, hail. Hail, hail, alma mater, hail to De La Salle. We'll hold your banner high and bright, the shield of green and white. We'll fight to keep your glory bright, and never shall we fail. Hail to thee, our alma mater, hail, hail, hail. Hail to thee, our alma mater, hail, hail, hail.
This has been a great and inspirational webinar. We learned a lot of lessons from this webinar this afternoon. Once again, I am your host, Joyce Villena. Thank you for being with us this afternoon. Take care, everyone.
Hawak kamay, pikit mata, sumasabay sa musika. Gusto kitang isayaw ng mabakal.
Ilalagay ang iyong kamay sa aking bewang.
Isasabay sa tugtog ng kanta ating katawan. Handa-handahang matitikip ating